We are starting a new horizontal on policy. So just to say that like health economics, like any of these other lenses that we are trying to present to you, it's not really possible to kind of cover the breadth of approaches, the breadth of types of analysis, the intentions of these different disciplines within one day. Okay, so policy analysis is a well-established discipline in, it's been around for a long time. It's a sort of a subset of the political sciences. And it has been refined some extent for the health world. So there's a field of health policy analysis as well. And there's also strong overlap with what we call governance research. So there is no real field of governance research as such. It's not something where you see a journal of governance research or journal of health governance or anything like that. But there are a number of normative aspects, a number of analytical frameworks we can apply to study governance. So anyway, this is the reading. This is a sort of a reader for health policy. Buse, Mays and Walt, it's become very popular. Many people use it. And it's quite an effective introduction into policy analysis. Again, just maybe to emphasize that policy analysis is not just about analyzing how policies get made, but also about analyzing how policies get implemented. And the world of sort of governance research actually has closer linkages to the implementation side of things as much as to the policy making side of things. So we'll go into both those aspects. Okay, so I think we've done some of these slides before under HPSR because there's such a fundamental link with HPSR and policy analysis. But can you venture, I think we discussed this, what was the sort of final consensus that a lot of definitions come down to? What is policy? Decisions with a purpose. So I'm just going to take you through a range of definitions and how some of these definitions give very different perspectives. So the first two, so what governments choose to do or not to do. Not doing something is also a policy decision frequently. The process of public policy making involves a manner in which problems get conceptualized and brought to government for solution. Governmental institutions formulate alternatives and select solutions, and those solutions get implemented, evaluated and revised. So this is a descriptive definition, and these are both referring to a sort of a public policy making. So they place government at the center of that. Okay, and then there's the definition from the text which you will be reading. Decisions in both the public and private sectors taken by those with the responsibility for a given area. For example, health, education, environment and trade. So that's a sort of a sectoral definition of policy. Okay, I like this definition. This is from Jill Walt. 1994, a very nice reader called Health Policy, Process and Power. A series of more or less related activities and their intended and unintended consequences for those concerned, usually directed towards the accomplishment of some purpose or goal. It's quite vague, but it actually encompasses a lot of things which are not normally captured in definitions of policy. So activities, their consequences which may be both intended and unintended and directed towards a purpose or goal. Okay, this one takes us even broader. So this one suggests that policy, sorry if it's a bit hard to read at the back, it says as commonly used, the term policy is usually considered to apply to something bigger than particular decisions, but smaller than general social movements. A second and essential element in most writers' use of the term is purposiveness of some other kind. So we come back to this core issue of purpose and intention has to be there. But it's the other part of it that varies a lot. So this is really broad. So what is a particular decision? I open the bottle cap, that's a particular decision. I don't have to write a policy to open the bottle cap and drink some water. That's a particular decision. It's made in a particular context for a particular objective. So anything bigger than that, anything of an organized nature, but smaller than a general social movement. So can you give me an example of a general social movement? Sorry? Lokpal Bill movement. Okay, yeah. So that's not a policy. That's a social movement. Okay, so policies are smaller than that. To a large extent, when we talk about policies, this is really what we're talking about, decisions with a purpose, and hence the study of policy is the study of decisions and the study of purpose, the purpose that those decisions achieve. So understanding how decisions get made, why decisions get made, who makes decisions, that is the heart of policy analysis. Okay, types of policies. We went through this as well. Distributive, redistributive, regulatory and constituent. So this is more of a refresher. Maybe we can have a little bit of an exercise though and think about examples. Examples of a policy that is primarily distributory or redistributory in nature. So setting up UHC, and here again we have a broad definition of institutions. It doesn't necessarily mean a particular bounded organizational entity, but setting up UHC means setting up the institution of UHC, so that is a constituent type of policy. Interesting to note though that if you look at most of the policy making on UHC, it tends to focus, you see, instituting UHC, the term actually should refer to a more constituent element. How do we set up the institutions which will then implement UHC? However, most of the policies have been focused on the distributory aspects. So there is an example maybe of how policymakers should be reading a bit more policy studies and figuring out that any policy should have each of these three components. Until you set up the institutions that are going to implement UHC, you're saying that distribute it like this, allocate it like this is not going to have much impact. That's a great insight. Thank you. Any other thoughts?
So maybe setting up of NHSRC when NRHS.
Exactly. Okay. That is exactly. Health resource centers were set up. There was an institutional model through which technical assistance would be provided for the execution of the NRHM. So that's an example of a constituent. So that was, that is a far-thinking kind of idea. So, but we often miss out on the constituent elements. But I think also a general point is there to be made about the fact that we tend to overlay on systems rather than reform systems sometimes or replace systems. Have you ever heard of institutions being dismantled? Can you give me an example of a health institution being dismantled? Sorry? Planning Commission. Okay, great. What about health policy? Okay, so that's high politics. Okay, so, okay, yeah, and that was accompanied by a major regime shift. But can we think about an example in the health world or the of health systems of an organization or a system or an institution that was deemed to be not working and it was hence actively dismantled? Okay, I mean, I'm not saying it's good or bad to dismantle something, but it just strikes me that not a lot of institutions get dismantled actually. And I suppose there's a very interesting political economy of that as well. Why I suppose there are a lot of interests that get tied into particular institutions and it's hard to dislodge those interests. But that's just hypothetical. But anyway, I think what we can take away from this is that now whenever you think about a policy, and now I'm talking about a policy in the lay sort of connotation in terms of policy content, not the sort of wider framework that we want to take. But even if you're looking at policy content, I think whenever you think about a policy, whenever you read a policy, just do a quick check. What are the constituent elements of this policy? What are the regulatory elements of this policy? What are the distributory elements of this policy? And that will just give you a sort of an internal framework within which to judge if it looks like, there's something missing. And I frequently find that this part is missing in any policy. So anyway, just something to help you think through. And this is a fairly fundamental taxonomy of policies. So it's also important to be simple. When we're talking about complex issues such as policy, sometimes the simplicity is important. We need a simple way of describing complexity. Why do we need health policy? Any thoughts? To create a larger framework within which we operate. Okay, great. Any other thoughts?
Give a direction.
So that's kind of the same thing, isn't it? Like framework, strategy, okay, direction, impetus. Okay. So I think here I'm trying to refer to the sort of broader objectives of creating policy. And yes, of course, it is. But I mean, they can be oriented towards managing existing systems and giving that kind of architectural shape to health systems. They can be directed towards how we look at distribution of services or resources, and they can be looked at in terms of how we can best achieve health goals and objectives. So, I mean, this is not an exhaustive list by any means. It's just a way for us to organize our thoughts moving forward. So, and we will come to accountability when we come to the governance questions. So, let me just move forward on this, because I think it's not really giving us, I mean, we could really move in many different directions. But just to give you some sense of that, most health policies tend to get oriented around these kinds of principles. So, I'm just saying that as we see it in the real world, most policies tend to be referring to one of these points as their primary reason for existing. So just to give you an example, so when you have a new policy, it tends to either be directed around achieving a major health goal, and these are examples of those. So, you know, the universal health coverage, which is a goal, or the sort of MDGs, good health outcomes, high quality of services. So these are all seen as social goals that we want to achieve, and a policy will help us move in the direction of that particular goal. Alternatively, policies may be directed towards more appropriate distribution and allocation of particular resources, which could be either human, material, or financial, or knowledge resources. Yeah, so you may have particular policies for the human resources, or you may have particular policies for medicines, or you may have particular financial allocation policies. And also you can have policies for particular systems or institutions, so to manage existing systems better. So you can have policies for services, for administration, for financing, for information systems, etc., etc. You can have policies for policymaking institutions. What about NRHM? Can we think of the NRHM or the NHM? It was set up as a mission. So that's also another, see, the use of these words is very important. So why was it set up as a mission and not as a ayog or an institution? Yeah. There's a time-bound nature. Okay, so it was more like a. Okay, so there's a whole semantics of the program versus the mission versus the institution. Okay, great. Yeah. Okay. Great. Okay. And it gives you a very clear message, and that rhetoric of that is important. So it's not that, I mean, we talk about rhetoric often as a negative thing, but actually rhetoric can be important as well. Yeah. So okay, so I think words are really important in policy, and I think policy is really, in a way, the art of words. It's something that becomes very apparent, and that's why it becomes all the more important to make sure that those words have a meaning. Otherwise, you know, if they become dissociated of meaning, then, and maybe that's something that as policy analysts we can help to do. Okay, so stages of policy. This is something we've seen before. So this is the policy life cycle. Problem definition, identifying solutions, evaluating options, selecting an option, implementation, evaluation, problem. And this is another example of a similar kind of sequential thinking. Mandate, what is the mandate of public health? It's to collect evidence to create appropriate policy, which will give rise to effective programs, which will improve health. You collect information on that and it feeds back into your scientific evidence. Does it actually happen like this? Is this how things actually happen in the real world? No, I think we're all agreed that there are various ways in which it doesn't happen like this. At some times it does happen like this. But I think I'm quite comfortable in saying that in most cases you will not see a sort of a temporally delineated, a sort of a timeline based sequential progression of these events. What you will see is that, what will you see? Okay, so let me put it another way. Which is the weakest link in this chain? Okay, can we have, because this is an interesting exercise, I just like to have this. So scientific evidence to, so we're talking about the link in the chain, not, so which arrow is the weakest link? Not the entity itself. Which one? No, let's have hands, please.
The arrow between scientific evidence and appropriate.
So she's saying that uptake of evidence for policy is the weakest link in the chain. Anybody else?
Appropriate policy to effective.
Policy to program. Okay. Okay, anybody else? Policy to program. The feedback loop. Okay. Improved health to scientific evidence. Okay, so the creation of scientific evidence about improved health. Okay. Okay, so I mean, we already have very contrasting views on what is the weakest link in the chain. Generally speaking, a lot of scientists will think that this is the weakest chain. A lot of researchers will think that because obviously their research is not getting taken up. A lot of people who are making policies will think that people don't implement the policies that we make so nicely, so that is. And then program managers will be like, we're doing what we can, but it's not leading to anything. Yeah. So this is a classic example of how your positioning changes how you look at. And it's not only about gaps, but why this sort of simplistic vision of the policy cycle doesn't really always reflect in reality. Yes, we've established that there are gaps at various levels, and that's an important aspect, but there are also a number of other factors for why that doesn't reflect reality. Pluralistic policy. There's often a multiplicity of agencies, and very often there are overlaps with other sectors, and by sectors I mean both public and private sectors, non-state sectors, as well as other sectors of work, of productivity. So very often, like we've discussed, it's not the decisions that are made in the health ministry that are most significant for health, but decisions that are made in other sectors such as education or trade or agriculture. And even within a particular sector, you will find that there are many organizations which have overlapping mandates. It's not really clear which one is supposed to make the decision and which one is supposed to make which decision at what time. So all that needs to kind of get worked out and sorted out. And of course, we've established there are policy gaps. So gaps can be at various different levels. There are gaps in uptake of knowledge for policy. There are gaps in translation of knowledge into policy, and gaps in implementation of policy, and gaps finally, even when programs do get implemented, into making sure that they have an impact. And then this one, which is of course linked to this one, power and conflicts. Yep. So people have interests, people have vested interests in organizations, in systems, in institutions. They wield power, they have particular powers which may go over and above the influence that their organizations wield, or even particular organizations may have power which is disproportionate, either less or more than they actually should be having, and it's messy. The way that all these things get played out is often through dissent, conflict. Sometimes conflict doesn't manifest visibly but invisibly. And then this is a neglected, so power and conflicts, I think we'd all agree, but this one is a very neglected understanding. Sometimes we just don't know what the hell's going on. Things are unclear, things are fuzzy, lack of information. Even sometimes people working in specific organizations don't know what their organization is supposed to be doing. It's a state of being. They don't know what their organization's mandate is, and that is replicated throughout in every institution. Do our regulatory institutions know that they're supposed to be regulating? Do the people sitting there, do they know what regulation means? Are they fully aware? Do they have a particular interpretation which is different from what was originally mandated or what somebody else may think their role is to be? So these are all important considerations, and why I bring this up, again, this issue of complexity, is that these are the kind of rationales for why we need to study policy. Because if it was this simple, then we wouldn't need to study it. It's just happening. But because of these issues, and these are not inconsiderable issues, these are very major issues, they can cause the system to completely choke up and stop. And this is why we need to research. So the policy analysts, what they do is essentially they're shining a light into the darkness. Yeah. So there's this kind of complex maze which is all happening in the dark, and we don't know. So we are trying to reduce some of this. We're trying to just shine a light, maybe help people think about what's actually happening. Okay, so a lot of the kind of thinking around why we study health policy is organized around these principles to understand who makes decisions. Even if you remove the word policy here, it would still work. Who makes decisions, and not just the decisions at the top, but decisions throughout the chain. Like we discussed the other day, sometimes it's the frontline provider who is making the critical decisions. In fact, it is the frontline provider. in healthcare, if you're talking about healthcare, it's a frontline provider who is making the most important, the determining decisions for the fate of the user. So is that person the most important person in the chain? Should we be focusing our attentions on how that person is making decisions, or should we be focusing our attentions on how other people at different levels in the chain make decisions? They're all important, but this issue of power is important. So if service providers say that they are powerless, that's not entirely true. Actually, they have a lot of power, but where is that power being directed? How is it being directed? Are they able to utilize it in the right way? All of those are questions to consider. And then along with power, we also want to answer these how and why questions. How and why these decisions are made. Process. So we are not only interested in structure, while we are interested in structure. So that's again why it's important to move away from the content thinking about policy. Policy is not a static thing. Policy is a living, breathing thing. And it changes. And it occurs over a period of time. So understanding that process is crucial. Now it's not so important for us whether so it is important that the Niti Aayog has been set up. Now it's more important for us to see how it responds to stimuli, how it responds to needs over a period of time. And that's why we need to understand the process. To learn about the contents, of course, we cannot neglect content. It is also important to learn about the contents of existing health policies. And finally, also to learn how to plan and make policies. But I'd just like to say, we're going to focus on these two elements, power and process, with an understanding that this is all towards better understanding and hence contributing to change. And this is the overarching framework that I would like to apply, and we've already touched on many of these issues. So when we talk about power and decision making, it's who is making the decisions, what power do they have to make those decisions. It's the actors who are central in all of that, and that's why we put the actors in the middle. Content is important, but also important is process, and context is also absolutely crucial. So we'll talk a little bit about what we mean by context. Is there a way of organizing how we think about context, or is context just something that we can invoke anytime we feel uncomfortable with something that we don't know, something, so that's contextual? Or is there a way we can actually think about how to analyze context? So that's also something we can touch upon, unfortunately not in too much depth today because there's limited time, but I'll give you a framework which can potentially be used for that.